We treat, obviously, the first thing that patients come to is, like you said, lower back pain, but also neck pain, fibromyalgia, migraine headaches, jaw issues, foot pain, knee pain, even when a patient comes in and they just want to be checked because they see that they have, the difference in they're not carrying themselves well, or they actually also are just asking for other advice as well. But mostly it's going to be a lot of low back pain and neck pain and, jaw, shoulder, and knee pain as well, and hip pain. That's going to vary from person to person because obviously, it depends on how long the issue has been there. Number two, if they have any secondary conditions or secondary damages to their discs, to their joints, to those kind of things. When a patient gets treated, we always tell patients to expect a level of soreness to occur, because what's happening is we are engaging the nervous system at that level of the spine, and the muscles that correspond to the joint that holds it in place will undergo what they call a reset. And when we reset the joints and the Golgi tendons of the muscle, that's going to change how the muscle functions and how it actually moves. So part of what we do will have some soreness because of the release of the tension in the muscle tissues and also two of the joints as well. We treat everyone. We can imagine from birth, when a child is get it out of the birth canal, and a lot of tension is put in their neck and the shoulders. What we tend to see as chiropractors is even as babies as young as 2-3 months old, they are either fussy or they're crying all night because they either have issues with not processing their food well, or whatever it is that they're taking well. And we treat them and they actually resolve very quickly. We also treat children who have ear infections. Part of the process of actually getting the teeth coming in, a lot of course, drooling, and little babies putting things into their mouth will obviously cause a lot of ear infections, and also too with a condition called Erb's palsy, where the shoulder gets implicated as the child is coming out of the birth canal, as well as also too torticollis, where the neck is turned this way and the baby cannot necessarily move their head a certain point, all because of the traumas of birthing. So we see children as young as toddlers and infants. We also see children throughout their entire life as well, and adults and elderly too as well. So it depends on, number one, the access to chiropractic care in their town or in their city, and number two, what the patient brings to the office and what concerns that they have that they want to be addressed. I believe more than 90% don't cover chiropractic treatment, unfortunately. I say unfortunately because what we do is a very needed service here in Kenya as far as addressing different musculoskeletal conditions, and also help with pain mediation, and also to remedying different situations and conditions. Some insurance companies will reimburse the patient or the client the payments that they make for their services in the clinic. So it depends on what insurance you have and whether they recognize that. I know companies like Cigna and I think Cooperative Bank will definitely either cover chiropractic services or at least give a full reimbursement of services provided.